Hello everyone, it's Dr. Dave. Hopefully you're all doing well, having a nice week. Looking forward to the coming weekend. Coming at you today on behalf of the Toronto Neck and Back Pain Clinic with your daily health update. It's Thursday, April 8th, 2021. I'm going to share with you 6 areas of health and wellness news or information from the latest research and literature. Somewhere around this video you can read through all 6 areas. If you would like a copy, DM us on social, give us a call here at the clinic, or send us an email. We'll make sure we get that to you. Not going to treat, diagnose, prevent, or cure any illness or disease today. However, we will try to educate you, empower you, and maybe even entertain you a little bit to keep taking care of yourself and creating those great experiences you want in your day every day by being healthy. It's a good idea. So good for you for being here. A few areas you can read through on your own if it's of interest. The Journal of the American College of Cardiology, February 2021, looked at women with preeclampsia, high blood pressure during pregnancy, and found that it could compromise their long-term heart health. So a connection there that you'd want to work with a healthcare provider to, of course, be as healthy as you can before and during your pregnancy, and then know that if there had been any side effects, you may want to watch out for what you can do to negate the side effects of that sometimes challenging process of bringing that wonderful creation into the world, right? And for those of us with children that have Down syndrome, or maybe it is predisposed or runs in the family, and you're wondering if there's anything that can support that process, Scientific Reports, March 2021, looked at the benefit of green tea extract with children that have Down syndrome. So you can read through that. It's very preliminary research, of course, but they're looking at some of the potential benefits of these kinds of nutritional or diet approaches, of which green tea extract may be one. The Frontiers in Medicine report, March 2021, looked at the CPAP machine and how it can reduce sleep apnea-related kidney disease. So again, sometimes when we have one health challenge, we have some comorbidity, another or second health challenge that can develop. In this case, if you have sleep apnea and you use the CPAP, it may help avoid kidney dysfunction or problems that can come along with that condition. So good to read through that and seek out the appropriate medical or other allied healthcare support for any of those concerns. And Neurology, March 2021, the journal looked at concussions that can result in long-term sleep woes. Analysis of data concerning nearly 200,000 military veterans revealed that those with a history of traumatic brain injury were nearly 50% more likely to experience a sleep disorder, such as insomnia, sleep apnea, sleep movement disorders, and excessive daytime sleepiness. The authors of the study said that since sleep disorders affect people's quality of life and their rehabilitation process, it will be important to develop strategies to identify these disorders early, as well as prevent them from occurring after traumatic brain injuries to improve people's overall quality of life and health. So, of course, healing happens when we sleep, and if you have a concussion and it affects that quality of the sleep, or the ability to sleep, it obviously has an impact on the ability to heal and stay healthy. So being able to work on improving sleep or ensuring good sleep if and when a concussion happens can be very valuable. Okay, and there are strategies for that. Again, a lot of paramedical providers as well as medical providers and specific sleep clinics can help with that. If you exercise and your muscles get sore, which they sometimes do when you give yourself a good effort, the report from Sing Health, March 2021, had some tips on how to relieve post-workout muscle pain and soreness. They suggest using an ice pack for swelling or a heat pack for soreness, getting a massage, stretch more before and after you exercise, do light exercises such as walking or swimming to help eliminate lactic acid accumulation in the muscles from harder workouts, and take a warm bath to increase circulation and reduce muscle tension and pain. So some good suggestions there. I think some of the other research says that within about a minute to 90 seconds, most of the lactic acid in the muscles does dissipate, is taken out by your body. because it is harmful. So I think some other kind of chemicals, serotonin, histamine, and similar ones can be in the tissue still, then they do need to be flushed out. And some of these suggestions will definitely help, especially if it's more of a long-term soreness. So good to not be sore after every workout, or at least from working out. Occasionally it's good to feel good. Finally, for our tootsies, our feet, the Journal of the Pakistan Medical Association, December 2020, looked at high heels and musculoskeletal pain. 174 women completed questionnaires, and it revealed that frequently wearing heels is associated with increased pain and discomfort in the shoulders and upper back, especially with greater heel height. The findings suggest that regular heel wearers with shoulder and upper back pain could reduce their discomfort by using shorter heels or switching to flats. Of course, even though we can wear them, and don't personally wear them, but we could, and it's possible to do, and some people may be more adept in walking and standing in different kinds of shoes. Most of us feel relief when we get out of something that's not quite as comfortable, and or have a chance to put on something that's more comfortable. So footwear is very important and maintains and sustains the function of our feet, the quality of how well they work and how well they feel throughout our life. But based on the research and literature, there can be an impact on how the rest of the body works. And if it's not working well because it's challenged by what we wear on our feet, then we can develop some aches and pains in other areas. So of course it all works together, so it's good to keep every area sitting and moving well. And so make sure you're wearing something that's well cushioned and well supportive of your feet, and then watch your posture throughout the day. Take good care of yourself, and have some awareness about what you're doing and how you're doing it. It will go a long way to making sure that each day is as good as it can be. All right, so that's your daily health update for Thursday. Thanks for tuning in. Tomorrow, Friday, we'll have a written version for you posted on the different social media networks and channels. And we'll let you get through the weekend. Hopefully you'll have some time to yourself to recoup and recover, and enjoy as much as you can the weather and getting outside. Not a lot of things to do, especially here in the Toronto area in Ontario, Canada, based on the current lockdown, but hopefully in your area things are opening up and you're able to get out and do more and see people and stay well. But regardless, make sure you do take care of yourself. Have a wonderful weekend. We'll be back next Monday with your daily health update video format. We'll look forward to chatting with you then. All the best.